Hello and welcome. My name is Valerie Lapp, and today I will be presenting NK1, the Magnet New Knowledge and Nursing Research Infrastructure. So, a little about me first. I've been a nurse for 27 years. I'm a PhD prepared nurse scientist and have taught for 11 years as adjunct faculty in a clinical instructor role within the hospital. I'm also a board certified advanced nurse executive and certified pediatric nurse. Prior to my nursing career, I was fortunate to travel the world for 10 years, where I visited over 70 countries. This is me presenting my research at the Magnet Conference in 2022 in Philadelphia. I invite you to visit me this year in 2026 at the Magnet Conference in Chicago, where I'll be presenting on a research study titled Parents' Perception of Hospital Care Coordination. It's the concurrent session M654 on Friday, October the 30th at 2 in the afternoon. This study was conducted in a pediatric hospital, but you could very well be adapting this to an adult hospital population. I would love to meet you there and talk about improving patient satisfaction scores. So this is the requirement for NK1. You'll notice that research is underlined in the top sentence and also bolded in the bottom sentence. So research must be the focus. Provide a description with supporting evidence of the infrastructure that supports nursing research in the organization. And the analyst tip, examples of infrastructure may include the organization's personnel, policies, and processes that provide the structure, guidance, and resources that support nurses' participation in and leading nursing research. So let's start with a research council. I have found that by including evidence-based practice and quality improvement projects, interest and attendance increase in the nursing councils, as nurses have some knowledge in these areas. So, develop your councils. And what will you showcase? Will your council be face-to-face, hybrid, or will it be all virtual? And then describe the details about who leads the research council, their credentials, their title, their education background. What is their research focus if they have one? How are nurse members supported in their role? Is there dedicated time for nurses to attend the research meeting? How often does your research council meet? Monthly, quarterly, twice a year? What is on the agenda? Who writes the minutes and who keeps the attendance roster? Keep those agendas, minutes, and attendance roster to show appraisers on site visits, as they sometimes ask to see them. What is the purpose of the meeting? Is it a working meeting? And then invite speakers. I'll talk about your librarian and biostatistician later. But academia could talk about their research. Maybe you could collaborate. After all, you open your doors to hundreds of students on your units every year. So if you have a council, you should have a charter. Who sits on the charter? How is voting established? How is the chair determined, by vote or appointment? And if you're using your nursing research policy, the evidence, make sure that it is updated, as all documents for evidence need to have dates on for the document. So this is a problem we sometimes see. There is no IRB at your hospital. In order for your research to be counted on the Magnet research table, there must be a nurse who is either the PI, principal investigator, the co-investigator, or the site principal investigator. So can you affiliate with academia? Maybe partner with a larger hospital system? If that's not an option, use an external independent IRB such as Advara or Citero. There are others you can Google, and there will be a fee. Consider partnering with your favorite physician on their study as a co-investigator. And then you could also join a multi-site study. Site PI also works for the Magnet research table. So I have noticed previous networking during the poster presentations at conferences with the offer to expand the presenter's study using their patient population. So keep an eye out for people that maybe want to extend their studies. Maybe they've done a pilot and you can suggest, how about if we joined you with our population to increase your numbers and you could do a full study? So your budget, are you supported? Do you have a budget? And how much is your hospital willing to spend on research? Conferences are expensive. Nothing kills interest more than a nurse getting a poster or podium presentation accepted to find that their hospital will not fund them. So questions to ask yourself if budgets are tight. Is the conference local? Definitely cuts down on travel and hotel costs, and then you might be able to go. Librarians can be a tremendous resource. They can obtain journals for you that you aren't able to, that would cost you money to obtain. So they can help with a literature review. So all of you getting your DMPs, they can be an absolute asset to you with that. Invite them to present at the council on searching the literature. Every time I've ever been to a session with a librarian presenting on how to search the literature, I have learned something. They're amazing. And of course, they have educational resources for you. Do you have access to researchers? Do nurses know how to reach you for guidance? How about a SharePoint site, intranet site, and then put the link to the researchers on that site? And you could take screenshots for evidence of access for the Magnet document. How are nurses supported? Is there dedicated time to pursue research activities? How about a clinical ladder? Are they supported with a clinical ladder? Do they get points for conducting research? How about a monetary award for study completion and dissemination as a principal investigator? How are they recognized? How do new grads and new hires hear about research during orientation? And then support for planning a study or preparing an abstract poster or presentation. You could write an example of how a nurse or group of nurses were supported during the planning of their study or in preparing an abstract or a poster or a presentation. Who helped mentor and guide? The evidence could be emails that go back and forth with questions and then thanks for support. And there could also be meeting minutes for that. So I suggest you upload examples of previous work for guidance for nurses. They may be keen to work on some idea, but they lack the knowledge and just don't know where to start. So on an internet site, post your research posters that have been to conferences, your evidence-based projects, that includes your DMP projects, your QI projects, podium presentations, manuscripts, grant applications, and any awards that were given. And then also on their list, a call for abstracts with the due dates and a link to the site. So they can they know when the abstracts are due, the due dates are, and that they can also follow along with the requirements for the conference. So promotion of research. How is your research promoted and publicized to encourage nurses' involvement? And then how is the work disseminated? So if you disseminate to an internal audience, you fulfill NK3A and NK3B. Internal audiences could be your unit nurse practice councils, where the study data was collected. And it's nice for nurses to see the results, and it closes the gap on why the data was collected. You could also present at the Hospital Nursing Research Council. And then for an external audience, which fulfills the requirements for NK4, you could present maybe to local colleges. They might have a day where they have research presented. The local chapter of Sigma Theta Tau, the American Nurses Association, and then your local chapter. And of course, specialty conferences, leadership conferences, and then Magnet. There's plenty of conferences out there. So your nurses have completed a lot of work to get their study off the ground. They've collected the data, they've submitted an abstract to a conference, and nervously presented their findings. Do they automatically get to attend the conference free where they were selected to present at? So how are they recognized? Are there posters displayed in the hallway? That would be nice so that everyone can see the work that they've done, and it may instill interest in other nurses. I'd like to do this. How about a nice write-up in a nursing newsletter? And then for those who don't like, those few who don't like public recognition, how about a one-on-one acknowledgement of their coaching plan? So, no biostatistician. Many hospitals have this problem. They don't have access to a biostatistician. So, as a last resort, you could use AI. AI such as ChatGPT, Perplexity, Claude. I mean, there are others. So I have a disclaimer. Although AI can assist with analysis and interpretation, it is not a substitute for a medical biostatistician. A word of caution, they can make up citations. I think we might have seen this in the news fairly recently, which are called an hallucination. So if they don't know something, they'll just make something up. So be cautious. AI, when questioned, can analyze your data, compute inferential statistics, check assumptions, interpret the findings, and provide publication-ready wording. But of course, once again, I caution that, and you definitely need to proof that for errors. So you can also use Microsoft Excel for some basic statistics. Just Google how to use it. There is also G-Power, which is a free, widely used software program for computing statistical power, sample, and effect size, when you want to know how many people you will need to collect data on for the results to be valid. Researchers typically run it to determine exactly how many participants are needed to detect an expected effect. So if you upload a data set, you can tell AI your research question and your variables, and a hypothesis if you have one. You can provide an Excel spreadsheet, tables pasted directly, SPSS style summaries, raw numbers, and screenshots if they are readable and the data can be extracted. So perhaps you have an education study and you want to check the knowledge to start with, and then again after the educational session to determine if knowledge has improved. So you can ask AI a specific question. You might say, here's my data set comparing pre- and post-intervention scores. Run a paired t-test and report the effect size. AI would analyze the data, compute the inferential statistics, check the assumptions. Checking assumptions just means verifying that your data meets certain specific conditions required for statistical tests to be valid. For example, many statistics require that data is not skewed, meaning that data should follow a bell-shaped curve, or the variance or spread of data should be roughly the same across different groups. And then AI would also interpret the findings and provide publication-ready wording in APA style. As I say, be careful, be aware. Just make sure you proof it carefully. So if you provide the data, paste it, upload a file, or describe the data set, AI will run the inferential statistic analyses. They will come back with t-tests, independent, paired, or one sample, ANOVA, repeated measures ANOVA, chi-square tests, correlation such as Pearson or Spearman, linear and logistic regression, non-parametric tests such as Mann-Whitney, Wilcoxon, Russell-Wallace. Confidence intervals, effect sizes, power and sample size reasoning. It will return the test statistics, the P and the F test. That notation, that X2 is notation for chi-square, z-scores, p-values, confidence intervals, assumption checks, interpretation in plain language, APA style or publication ready reporting if that's needed. I tell many that shy away from research that you are not trying to solve world peace. Just complete a small, uncomplicated study that is both meaningful to the nurses and maybe addresses a hospital's strategic plan. You can partially avoid quantitative studies and investigate with qualitative studies. You would need help with writing the protocol proposal, tape recording the responses and typing verbatim those responses, and determining the themes that you discover. I actually prefer qualitative data. Qualitative research provides deep contextual insight into human behavior by uncovering the why and the how behind actions. Quantitative data can show you the numbers, how many of something is happening. For example, something that we can all relate to. 65% is the quantitative data of shoppers do not place their shopping cart back in the corral at the grocery store parking lot. Whereas qualitative data explains why it happens by capturing personal opinions and motivations. Respondents might say when questioned, there were not enough corrals. Hey, it's too far for me to walk. I need the cart for support to walk. It's raining. It's too hot. I have small children with me and don't want to leave them alone in the car. Just can't be bothered. See how much more you learn from that? And how much maybe more the grocery store could accommodate people. Now for the final slide. The moment you hear your hospital is Magnet. It's such a great feeling, even if it's your first or 7th time. I hope this helped make NK1 less intimidating. Thank you for joining me.